Hello and welcome to the EduTalk series hosted by Biotone EduPartner Program, and massage industry experts. With the growing interest and popularity of the EduTalk series, Biotone continues to support virtual learning and building massage community by connecting you with industry experts who share their knowledge and expertise on topics not only for class discussion, but career success. Tonight's expert is Dr. Susan Salvo, a practicing massage therapist with over 40 years experience. Susan's an educator and industry presenter and author of 2 massage textbooks, Massage Therapy, Principles and Practice, now in its 7th edition, and Mosby's Pathology for Massage Professionals, now in its 5th edition. Susan's written numerous industry articles as well, and reviews case study reports for the Massage Therapy Foundation. She's participated in Massage Therapy Body of Knowledge Project and Council of State Governments Interstate Compact. And if she's not busy enough, her blog is entitled Susan Salvo's Massage Passport, Massage Practitioner's Guide to Pathology, Special Populations, Self-Care, and Improved Professional Practice. Let's listen and learn as Susan shares how to safely modify massage and massage positions through each trimester. She'll discuss high risks, postponing massages, miscarriages, blood clots, lower back and uterine ligament pain, general and specific edema concerns, referrals and pathologies related to pregnancy. Plus, she'll share tips on spa services, hot tubs, saunas, essential oils, and CBD topicals for mother-to-be safety. Thank you again, Susan, for joining us. This is going to be, as you mentioned, a power-packed talk. I'll turn it over to you. We'll see you. I'll be back on a few minutes before the end, just to give you a time alert. And I'll see you then. Everybody feel free to chat questions or comments during Susan's talk, which she'll answer at the end. Again, thank you, everyone.
Thank you very much. What a lovely host. And I really appreciate Biotone for having these talks. It's very important that massage practitioners stay up to date and current on changes in practice guidelines. And this is one that gets a lot of questions asked about it because there's a lot of misinformation. And hopefully by the end of the talk, you will have some really good guidelines about how you should be handling your pregnant clients. It is considered a special population, just to kind of give you some guidelines, special populations. And so I do want to give you as much information as I can. And we are going to be using a PowerPoint. And I'm going to go to, give me just a second, slideshow. Hang on just a second. It's a little awkward because the way the program works, it hides the top bar when the Zoom bar is up. So I have to be a little creative on how I get that set up. Okay, so I can't see well. So can you guys see the PowerPoint slide? Just kind of give me a yes or a no.
Yes.
Awesome, great, fantastic. So I'm going to skip the bio, except for to talk about, I'm passionately curious, and I am really a person, if I don't know a topic, I know how to find out the most up-to-date information about it because I am so passionately curious. These are the 2 textbooks that I've written. The 7th edition is Massage Therapy Principles and Practice. Most of the information I'm going to be giving you today comes from this textbook. And the pathology information that I'm going to be discussing, it will be in Mosby's Pathology. But I do want to add, this is a great topic for a future talk, but mental disorders is a real hot topic right now in massage schools. And you're going to be seeing this. This is one of the main reasons why pregnant clients come to get a massage is for improved mental health status. And in the pathology book, I'll go into a whole lot of detail about things like prenatal depression, postpartum depression, and such. We have a lot of good research on it. So the very first thing I want to do is I want to give you the definition of pregnancy. And not surprising, it's the sequence of events that begins with implantation of the embryo and ends in childbirth. So pregnancy massage, when you really look at the definition of pregnancy massage, it's the modifications of techniques, massage techniques and body positions to meet the needs of the pregnant woman's body during pregnancy and during the postpartum period. So it's going to include both phases of it. So this is a bit of research that came from a study that I found, and also from the AMTA comes out with a research report every year. And so they have a practitioner side where they're asking practitioners questions, and they have an educator side where they're asking educators questions, and then they have a client side where they ask clients a lot of questions. And so when you ask pregnant clients what the #1 reason they seek massage, it's for lower back pain. So when you read a study like this, what it tells me is that massage therapists who wants to serve this population better know how to give a fantastic lower back routine, because this is the #1 reason that brings people on the table. So hip pain, shoulder pain, neck pain, as well as improved mental health are other common reasons stated by not massage practitioners, but by massage clients, by pregnant clients. We ask them, why do you receive a massage? So we're going to divide pregnancy into trimesters. And the first trimester is week 1 to week 14. The second trimester we're going to define as week 15 to 28. The third trimester is week 29 to 40. And most of the discomforts that a pregnant client experiences is trimester dependent. And this will give us the platform that we use to talk about massage modifications for it. So now, the first thing I want to say is it's very important that you teach massage to the co-parents and the caregivers. And I like to use this picture because the whole idea of family has changed dramatically over the last 20 years. It's no longer a traditional family. We are moving into seeing a whole lot more non-traditional families. So, and just keep in mind that the person taking care of the child may not be the birth parents anymore. It might be an extended family. It might be a domestic partner. It might be a best friend, a BFF, all these things. So you need to be mindful and respectful of the changing face of the family, and be sure to include these key factors of the child's life whenever you are thinking about teaching massage. So like maybe during the middle trimester or the last trimester, the second or third trimester, invite a caregiver to come and show them a couple of simple massage techniques, a foot massage that they can do. It also improves access. And I'm all about improving access for massage for the people who need it. And pregnant women do need massage. So the first thing I want to dispel right off the bat, and this is fairly new research when you look at where the study came from, it was 2018, 2019, so it's fairly recent. But the question is, can pregnant clients use a hot tub or use a wet or a dry sauna? And the answer is absolutely. They can sit in hot tubs or saunas for 20 minutes or less during any trimester. And this is the range of safety by Ravenella 2018. And they discovered that the bath temperature needs to be about 104 degrees Fahrenheit, which is pretty hot, or 40 degrees centigrade. And sauna temperatures need to be about 158, which is 70 degrees centigrade, at about 15% humidity for a dry sauna. And any temperatures or timeframes that exceed these guidelines may result in damage to the unborn. So great research study. And the next question I want to answer using research is, can I use essential oils during pregnancy massage? So what do you think, guys? Anybody want to unmute yourselves and give me your thoughts?
So it depends on the essential oil from my research. I don't know. Hopefully it's right. But there are certain essential oils that can be harmful or can lead to possibilities of miscarriage, but most essential oils are safe. Just trying to narrow down which ones are and aren't.
Well, the new research says all of them are safe. There have absolutely been no reports of any kind of harm to the mother or to the child on their use. So that's one great myth that has been dispelled. And this information came from Jane Buckle, who is a nurse, and she wrote a wonderful book, if you really get your hands on it, it's a clinical aromatherapy. And she develops a whole section just on pregnancy massage. And she says there's absolutely no validity to the myth that essential oils are unsafe in any trimester. So hopefully, again, another barrier that's been reduced between yourself, your practice, and your clients. So now the next question I'm going to ask is, can I use topical CBD products during pregnancy massage? Does anybody want to jump in and give a comment about that? Yes, no, you don't know?
Well, I don't, the way I currently feel about CBD is, as far as I know, the FDA has not officially done any testing on CBD.
Bam, that's exactly right. So the answer is, that's the position statement, very good, by the FDA is they are not recommending it because there's no evidence suggesting its safety during this developmentally important time. And what's interesting about this topic in particular, if you know anything about research studies or know anything about IRBs, which is institutional review boards, it would be very difficult for a IRB to even approve a study on something like CBD, because if it could cause harm, then typically they don't want to even approve the study. So for the position right now, according to the FDA, is they're saying they're not recommended. So something to be mindful of. Now, the whole concept of massaging on the belly, we are asking, and this is actually true not just for pregnant clients, this is true for a regular non-pregnant client, but you always want to get permission. And I like to use what's called a double layer consent. What a double layer consent is, where you get the verbal consent before the massage procedure, and it's going to be written, in the consent forms, one of the 3 documents. In fact, if you want to go back and look at some of the EduTalk library, one of the first talks I did for Biotone was on documentation. So the intake form will discuss that part. But then the second layer of consent is during the massage itself. So even they're on the table, they're on their side, and you can ask permission if they want to have it done, and you can use, and if they grant permission that second time, then you use an open flat palm, only the weight of your hand, so it's not a lot of pressure. I like to say no pointy tools. This is what I'm talking about. You're not going to curve your fingers, no pointy tools, no airspace. So again, so it's the full weight of a flat palm, just the weight of your hand. And if they have a previous pregnancy loss or a previous preterm or premature birth, it's probably not recommended, just for the discomfort of it, the emotional discomfort of it. But keep those things in mind. There is some evidence to suggest, of course, you'll find out when we start talking about first trimester, that massage, including abdominal massage, during embryo transfer for IVF, in vitro fertilization, actually improve pregnancy rates and improve birth rates. So there's a lot of support for abdominal massage and massage in general in the first trimester, especially in those cases where you think it would be contraindicated, but research says, no, it's safe and warranted and indicated. So the opposite is true. So now we're going to define a little bit about high-risk pregnancy. And so what is a high-risk pregnancy? It's one that is more likely to experience complications, and it could be complications for the mother, or it could be complications for the fetus or higher order multiples. And usually is associated with the disease, but there are other risk factors as well. Again, higher order multiples is considered a contributing factor, a risk factor for high-risk pregnancy. And maternal age is actually one. If the person carrying the baby is under 15 or over 35, it's considered a possible high risk. What the next acronym stands for is gestational diabetes mellitus, also a risk factor. HPV is high blood pressure. HIV is human immunodeficiency virus. Preeclampsia is another risk factor for high-risk pregnancy, as is placenta previa. These are not the only risk factors, but this is just a handful of them. And I do like this picture. So what I did was, and I really borrowed a lot of information from one of my favorite scholars. I have many favorite massage pregnancy scholars, I call them. So this came from Elaine Stillerman, if you guys are familiar with Elaine Stillerman. And so she breaks the whole thing down into several categories. And she says, if maternal age or if multiple babies are the risk factor, there's no special modifications required except for those for pregnancy massage. However, there are other modifications that are going to be needed, but they're going to be discussed when we start going into them in their second and third trimester. So things like preeclampsia and gestational diabetes mellitus will be discussed in those sections. So let's talk about first trimester. Now, I want to stay here for just a second. You have to understand that not everyone who is pregnant wants to be pregnant. So they may come to you and disclose that they're pregnant and be happy about it. They may be sad about it. They may be indifferent about it. So you have to just take clients where they are, not where you think they should be. So be very loving, very accepting. If they need to emote, let them emote. So just be mindful that it might be a very emotional time for them because they're just now finding out and their body's going through a lot of changes. So the very first things we need to be thinking about for the first trimester is two risk factors or two things to modify massage for. One is going to be for deep vein thrombosis. We're going to call it DVT. And one is going to be for morning sickness. Got a little bit more information on each one I want to share with you. So the very first thing we need to dispel is the myth, and I do say the myth, that massage or even foot reflexology can cause miscarriage or preterm birth. This is a myth that's got to go away. It's not founded on any piece of evidence. In fact, the opposite is true. So it is safe. You can massage people in their first trimester, and you can work on their feet. And actually, something happened during 2020 when the Civil Rights Act expanded their definition to include the LGBTQ community, LGBTQ plus community. But what they did, they also added pregnancy status and nursing status. So right now, it is unlawful to deny someone in their first trimester massage or someone who's nursing. And that's just from a legal standpoint. So it can be illegal, but it's also unethical. So why is it unethical if we do that? It's unethical because it violates the person's autonomy and decisional authority. So when you're going through massage school and you learn about ethics, you'll find out there's different what's called requisite capacities for informed consent and for the therapeutic relationship. And the client should be able to make decisions about whether or not they want to or not want to receive services based on the actual risk versus benefits. So since there's no actual risk involved with the getting massage in the first trimester, that denying them that services is actually violating their personal autonomy and decisional authority. And also it goes into a little bit more about the Civil Rights Act in terms of them adding pregnancy status to it. And you can see it highlighted in the lower section. But they basically said that also the concept of justice is one of the concepts of ethical principles, those requisite capacities we talked about, that so you cannot discriminate against them for being pregnant. And so I want to define what discrimination is. It's unjust or prejudicial treatment based on a perceived difference. And I've listed here a couple of things that are typically associated with discrimination, but I did want you to make sure that you realize that pregnancy status has been added to the Civil Rights Act. So a little bit about deep vein thrombosis. So deep vein thrombosis is basically a thrombus, which is a medical term for a blood clot within a deep vein. 98% of them are in the leg. Leg is defined as the anatomic area between the knee and the ankle. So that kind of gives you a little bit about where it's going to be found. Now, pregnant clients have a 5 to 6 times higher risk factor for DVT, and this risk factor remains for 10 weeks postpartum. So anything that I teach you is called an overarching principle. Anything I teach you about this, you can be able to apply in the first, second, and third trimester, as well as 10 weeks postpartum. So the signs and symptoms of DVT, and look at that very first word carefully, unilateral, only on one side. This is going to be very important when we talk about screening for DVT. Unilateral leg swelling, you guys know what swelling is, heat, so you can feel it, redness or noticeable discoloration, and pain or tenderness. And pain is defined as pain without pressure or palpation. Tenderness is defined as discomfort with the application of pressure or palpation. So a little bit about massage and DVT. If they come into you and they say, I have a DVT diagnosis, and what research says is that most DVT is on the left side. That's going to give you some good information to use when you're dealing with pregnant clients. So, and I don't know why that is. That's just what the research says. So if they come in and they say, I have a DVT diagnosis, the safe practice procedure for you is you can still give them a massage, but it's to avoid the affected lower extremity. And lower extremity is defined as thigh and leg. So if they have DVT and they say it's in my left side, they can say it's their right side, but most people can say it's their left side. You just avoid the left lower extremity, okay? If they do not have a diagnosis, you're still going to screen for it. So you're going to look for signs and symptoms of DVT. They're on the previous slide. It will also be in the handout that we're going to be sending you after the talk today. And again, if they do test positive for DVT, you're not giving them a diagnosis, you're just screening for it, and you're going to apply the safe practice guidelines of avoid the affected lower extremity. And then you're going to caveat it with one extra piece of safe practice procedure, which is going to be refer them to their healthcare provider or the person that's managing their pregnancy for evaluation and treatment. And I've already mentioned that last bullet, so I don't need to go over it again. I've already said this, that left-sided DVT is more common during pregnancy than right-sided DVT. So the last thing we'll be talking about for the first trimester is morning sickness. And I want to mention to you this extra term, because it's a term that we talk about sometimes in massage school. It's a term you need to know if you're working with pregnancy. It's called hyperemesis gravidarum. Hyperemesis gravidarum. So morning sickness is basically, or some people call it nausea, vomiting of pregnancy. Is nausea with or without vomiting. It can begin as early as day 10. It usually dissipates by week 14, but not always. And that's the third sub-bullet we've already mentioned. Hyperemesis gravidarum is severe, uncontrollable nausea and vomiting. And some of these cases, like mine when I was pregnant for my twins, did require hospitalization because for me, it was related to the complication of dehydration. Oh, that's my cue. So massage and morning sickness and hyperemesis gravidarum. Massage is indicated. I love this so much. So if they are willing to get a massage, we have evidence, research evidence that says it can reduce symptoms. This is also true, again, with that overarching objective. This is also true with massage, nausea and vomiting, and hyperemesis with chemotherapy. So it's beneficial for those clients. However, you want to have some safe practice guidelines. You want to use a semi-reclining position when they are supine to reduce nausea. You want to avoid techniques that causes the body to rock and to shake because motion might worsen the nausea. I do a lot of trigger work. So this is one thing I'm not going to want to do in this situation. And it's really good to have disposable emesis bags available just in case you need them, or vomit bags, but who wants to say vomit? Okay, so that completes the first trimester discussion. Now we're going to move to the second trimester discussion. So we're going to modify massage for these three conditions. One is supine hypotensive syndrome, one is preeclampsia, and one is gestational diabetes. I am not saying you won't see this in the third trimester, but typically they're diagnosed in the second trimester. So what is supine hypotensive syndrome? It is a drop in blood pressure. Again, there's that hypotension, hypotensive, syndrome from compression of the pregnant uterus against the blood vessels. So I'm going to show you a picture in a few minutes, but and the bigger the woman gets, the more risk factor becomes. But you have two major blood vessels that runs in the abdomen, and that uterus is in front of it, and then the spine's behind it, the vertebral column. So if they're lying on their back, you can see the compression factor that might occur. Now, when this compression factor occurs, you have a decreased venous return, reduced cardiac output, and this may limit the placental blood flow for the baby or babies and lead to fetal distress. Signs and symptoms of supine hypotensive syndrome are dizziness, lightheadedness, shortness of breath, pallor, which is paleness of skin. Sometimes it's an ashen color to the skin, nausea, and agitation. This is the picture I promised you. You can see the pregnant client with her uterus, and you can see the spine drawn, and you can see the compression of the blood vessels. And the specific blood vessels are actually labeled in this illustration, the descending aorta, and then the inferior vena cava. So what the best practice guidelines we have is this is a positional modification. So you want to use what's called a left lateral tilt, or you can just use a sideline position. So why? It's because it's going to move the uterus off those blood vessels. So, and you want to begin this practice about week 22. But again, this is just a guideline. It's not a hard and fast rule. It might be earlier if the client is showing, okay? So what is a left lateral tilt? It's placing a small cushion right under the right hip, which is going to tilt, and they have to be in a semi-reclining position for this. It will tilt them to the left. That's why I said left lateral tilt. And what this position does is it moves the uterus off the blood vessels. Now, this is showing you a little bit. If you look at this picture, she has her arm up only because I want you to see the pillow. Now, in this case, it's a wedge pillow, but a travel pillow can work. A baby pillow, they're getting harder and harder to find, but you can use a firm baby pillow underneath. But also notice that she's still in that semi-reclining position. The lady in this picture is about 28 weeks, so she's a little bit farther along. But this picture says a lot of information about what to do. And we chose the two colors of the sheets, so it's easier to see, again, what you're looking at. So we like the contrast for this picture. Now, this is a picture showing you without the tilt. You can see the cross section, you can see the fetus inside the uterus, you can see the kidneys, you can see the intestines, you can see all the back muscles, the paraspinals, you can even see the liver. It's not identified, but you can point those things out if you know your anatomy. And then if the aorta is identified and the inferior cava is identified, and you can see the compression in this image. This next image shows you they have placed a cushion, a bolster, if you want to call it that, on the right side, and they're tilting the client to the left. And with that tilt, it does open those blood vessels that would have been compressed without the tilt. Now, this is showing you sideline position, and it's not a perfect picture. There's a lot of things now that I look at and I would change, but it still gives you a good balance between what you need to do. You can see the client sleeping on the side. Notice how her arm is laying in front of her. That's nice because this is uncomfortable when your arm is rotated back this way. So this forward rotation is so much easier on the shoulder joint. And you can also see how her elbow and her wrist is supported on those two pillows by her chest. You can see how one leg, the top leg, is bent, the hip is flexed, the knee is flexed, and it's resting, the knee and the ankles resting on the pillows by her lower extremity. But can you also see the rolled up towel that's underneath the foot that's resting on the table? So it's causing a little bit of elevation. Again, for the same reason we're doing it for the shoulders, we have to be concerned about comfortable position of the hips. But the important thing is the spine needs to be neutral and not rotated. This is why you have to have enough cushions to where the client's not collapsing in their upper extremity, their shoulders, or their lower extremities with their hips. And I like to tell my students that if I had a big tray and I were to go to the client and I would set the tray on the client, it would not tilt. So you want to have a nice even plane between, and I guess it's not perfect in this picture, but it's pretty close, between the hip, the knee, and the ankle, and the shoulder, and the elbow, and the wrist. So this will give you some good information about how to do your sideline position. Naturally, you want to remove all the pillows before asking the client to get up and get dressed. And this position, the sideline position and the left lateral tilt, is used also in the 3rd trimester as well. And then I want to say one more thing about pillows. I know that there's a lot of practitioners out there who, for whatever reason, they like to have a pillow or a bolster on the table while the client transfers on and off the table. That is not considered good practice. It might be fine when you're in your 20s and 30s, but once you have a pregnancy or any kind of disability or mobility impairment or any kind of joint problems, you know, advancing age, whatever, those become obstacles. So the best practices is have a barrier-free space when the client transfers on the table. Then you can put your bolsters and your pillows, but remove them before they get off the table, and always uncover the feet before you get them to get off the table. Okay, another question is, and this is so interesting because you get a million different answers if you ask a million people. Can you safely massage a pregnant client prone? And the answer is absolutely yes. There's actually no risk, no harm, no foul that the pregnant client will experience unless they just don't like it, but that's different than safety. Preference is different than safety. And so you can use a pregnancy pillow, and I'll show you one of those in the next slide. You can use a table that has the pregnancy option, as you see here, this is the kind of table that I have. Even when I'm not using the belly option, I always keep the little breast holes out. I like them when they're face down. And when you have a sheet on top, you really can't see those breast holes. But I also love it because you can imagine the clients now face up, and what those holes are good for is you can get really good neck and shoulder work when they're in the supine position. So I do like, though, that modification to the tabletop for not just my pregnant clients, but for my non-pregnant clients as well. And this is showing you a tabletop option. This is not my favorite, but it does exist and a lot of people like it. But you can buy this if you don't have a pregnancy table, or again, or just do sideline or the left lateral tilt. You've got some options here. You can even do a seated massage. Preterm labor sometimes happens in the 2nd trimester. It can happen in the 3rd. This gives you the definition, the textbook definition. So preterm labor or premature labor is regular uterine contractions resulting in only preterm labor when the cervix changes. It's either its size, which means it's dilating, or its length, which means it's effacing. And by definition, it's after week 20 or before week 37 gestation. And why it's bad is because it can cause preterm birth or premature birth. The health risks to the baby are greatest when the baby is born before 34 weeks, mainly because of lack of surfactants that are developing in the lungs. But that's another conversation. Actually, I lectured about that today when I studied the respiratory system. We talked about surfactants. So definitely, if a client is experiencing preterm labor, you want to postpone the massage. And typically, they're going to be monitored. They're going to be having bed rest, so they're not going to be on your table anyway. However, this is so fascinating about this topic. However, massage administered during pregnancy can reduce preterm labor risk, which is another reason why we want to be teaching massage to co-parents and caregivers to be administered at home. If the preterm labor does result in a preterm birth, there's a lot of research that talks about infant massage being done by the mother and actually they call this vicarious touch. It's a fascinating study, but they found out that if the woman was experiencing depression, a postpartum depression, and she actually watched her baby get a massage by a loved one, like a partner or a parent or a friend, it actually helped facilitate the bonding. So if she's not feeling up to it, just let her be exposed to it during that part of her motherhood, and it can actually help with bonding whenever the baby's at a NICU or whatever. So really, and I am trained in infant massage. So it is one of the things that if you're not trained in infant massage, it's a nice piece, a nice dimension if you're going to work with pregnant clients. So preeclampsia is going to be discussed next. It is persistent high blood pressure and protein in the urine. It often develops in the second trimester. 20 weeks or older, or longer, I should say, and resolves after childbirth if it's left untreated. And they typically are screening people for this as well, having them urinate in a cup, taking their blood pressure measurements, looking for those two signs for preeclampsia. It's more common in the first pregnancy if they've had many prior pregnancies, if it has young maternal age or advanced maternal age or higher order multiples. So if you look at this next slide, this talks about the type of swelling. In fact, if you guys remember your lymphatic system conversation, there's all kinds of types of edema. There's angioedema, there's ascites, there is pitting edema, there's dependent edema. The type of edema that's found in preeclampsia is called anasarca, and it's generalized swelling. And you can see it in her face, you can see it in her feet, and her legs, and her arms. So they just kind of blow up. So this is something that actually you can help screen for whenever you are working with this population. And this is kind of what the slide says. If they have preeclampsia and they have a diagnosis, you want to postpone the massage and until they're cleared by their client, by their client's healthcare provider. And sometimes they have to wait till the baby's born, and that's what resolves it. So you just have to play it by ear. However, you can also start screening for it by about week 20 by looking for the widespread edema, looking for the anasacarca. And also another risk factors is severe headaches and visual disturbances. If they're present, postpone the massage and refer them to their healthcare provider. And then again, this restriction is true for the third trimester as well. So gestational diabetes is next, and this is diabetes in pregnant females who did not already have diabetes. And this is more common if the pregnant female is obese, advanced maternal age, has a family history of it, and non-whites. So why is this so bad? Why is gestational diabetes mellitus so bad? Because it can lead to excessive fetal growth. So you guys who know someone who had gestational diabetes, or maybe you had gestational diabetes, these babies are usually 9, 10 pounds, and maybe even bigger. And preeclampsia is another risk factor if you have gestational diabetes, as well as maternal hypoglycemia, which can result in death. It's a very serious thing, hypoglycemia is. It can also lead to preterm birth, infant respiratory distress syndrome. So there's a lot of reasons why we want to identify this and manage it. And I want to say it's not that common. Well, common. What does that mean, common? It's about, some people, I read 3 to 8% of pregnancies. But again, they are screening for it. But this is one where you have to drink the drink, usually in the second trimester, and then you have to go back and you have to take your blood, and they have to kind of monitor you to see how your body responds to the sugar. And so if your client has gestational diabetes, you want to postpone the massage until the condition is well managed. Who determines that? You don't, the client does it. It's going to be the healthcare provider that makes that determination. Now, if they come in and they're monitoring their glucose with a glucometer, I like to say, how are you managing? How are you monitoring? Can you show me your device? Sometimes it's those continuous glucose monitors that's accessed with their cell phones. Then I'll say, put the cell phone where I can get to in case you need to check your blood sugar. If it's one of those stick things, we're seeing that less and less. But that was real popular maybe 5 or 10 years ago. But if they do have it for whatever reason, you want to put that again where you can get to it quickly so they can check their blood sugar. Now look at this next one. This next one is very, very important. It's more on the lines of pharmacology. But if they're insulin dependent or insulin requiring, and they're taking insulin injections. Why we inject insulin and not do it orally is because your digestive enzymes deactivate insulin. So you have to take it sub-Q. And so 2 studies came out where they said massaging over recent injection sites, and that's defined as 24 hours or less, can actually increase absorption rates, which can lead to decreased glucose levels and hypoglycemia. So you need to find out if your client's taking insulin. This is also true with diabetics that are taking insulin that are not pregnant. Find out where the recent injection sites are and avoid those areas for 24 hours. Okay, so we're going to move now into the 3rd trimester. There's a couple things we need to be mindful of. GERD, gastroesophageal reflux disease. Heartburn is really a symptom. Some people just say heartburn, but the proper term is actually GERD. Lower back pain and uterine ligament pain is also going to be more common in the 3rd trimester. Edema, not lymphedema. Edema in the legs, ankles, and feet. They may have varicosities, varicose veins, and they may have stretch marks. Of course, it can happen in any trimester. It did for me, but it's more common in the 3rd. Okay, so gastroesophageal reflux disease is regurgitation of gastric contents, that means stomach, gastrostomach, into the esophagus. So why they call it heartburn is because it burns right behind the sternum where the heart is located. So I've just defined what heartburn is, burning behind the sternum, which can worsen when lying down. Now, automatically, this is going to kind of lead you to the guidelines, because I like students to kind of click what's the symptom, what's the sign, and then it kind of leads you to the massage modification. And it usually begins this feeling of burning sensation in the chest, 30 to 60 minutes after a meal or at night. This is where it's most common. So client comes in, you want to try to schedule the appointment around the meal times, maybe not right after they eat. And of course, semi-reclining position, so important. And again, this is another overarching principle, which means it's not just a pregnant client with GERD and heartburn, it's any client with GERD and heartburn. Lower back pain. I like this picture a lot because it shows you from my left to right how the low back, how lordosis and that anterior pelvic tilt occurs as the pregnancy advances. So just leaning back to compensate for the increased abdominal girth can cause the strain in the lumbar spine and pelvis. And we also have relaxin, which does happen where you have the softening of the ligaments, and that can also contribute to low back pain. So again, I've already told you the number 1 reason why people come in. So I like to do a sideline massage, and I like to spend a lot of time on the lower back, lumbosacral and gluteal regions. So this is where I spend a lot of my pregnancy time on. Now, but look at this next bullet. If the lower back pain is severe or it does not subside after the massage, you need to refer them to their healthcare provider. Why? It's because that pain may not be lower back pain. It might be referred pain. It might be referred pain because of a kidney infection. It might be referred pain to a preterm labor. So this might be something that you follow up with your clients when they come in for lower back pain. Contact them the next day and see how they're doing. If it's not gotten any better, tell them maybe they need to go see a doctor to see what's going on. So this is a really, really nice thing to be mindful of when you're working with pregnancy clients. So there are 2 uterine ligaments that we have to talk about for pregnancy in this trimester. So uterine ligament pain is defined as a sudden, sharp jabbing pain from overstretched uterine ligaments. And what causes this pain is sudden movements, because typically it causes these ligaments to contract and then relax after a few seconds. So the 2 main ligaments we're going to be talking about today is the round ligament and the broad ligament. So the round ligament, and I'm going to show you a picture in a second. Well, I'll show you a picture right now. So you can see the round ligament. You can see it coming from the sides of the uterus and coming down. And it's interesting where it inserts. It inserts to the pubic area, the mons pubis area, and the pubic symphysis area. Now the broad ligament is going to be right here. It's cut, so you can see this other ligament right here. the uterosacral ligament. The uterosacral ligament, even though a lot of people who teach pregnancy massage talk a lot about it, it's really uncommon in problem in pregnancy massage. The only time you really, and Google this yourself, that you really only read about uterosacral pain is with endometriosis and vaginal prolapse. That's what's most associated with, not really pregnancy. So, but look at the broad ligament, and it's going to sweep behind, and it's going to go back and become part of the peritoneum. So let's look at the round ligament first. It's the ligament that arises from the front and the side, the anterior lateral uterus, and it passes through the groin into the labia majora and terminating at the mons pubis. So when it is painful, it refers pain like in the middle, right to the groin area, right to the abdomen. Some people say they feel it in their anterior thigh with that referred pain. This is the kind of pain that I experience, and I've had 5 pregnancies, 5 babies. The broad ligament is a wide double-layered section of the peritoneum. So this is that big serous membrane that is in your abdominal pelvic cavity, and it extends laterally from the uterus. It actually surrounds the ovaries, it surrounds the fallopian tubes, and connects to both the walls and the floor of the pelvis. So stretching of the broad ligament can cause lumbar pain or sacral pain and pain in the gluteal regions. We've already looked at this picture too. Wow. So what do you do with this? So if a client experiences pain when they're trying to roll over, when they're trying to get up off the table or reposition themselves, you want to ask them to stop, suggest that they lie back down slowly, remain there for a few minutes, wait till that discomfort or the pain subsides, and then I tell them, try moving again, but just more slowly this time. So kind of coach them through it. Sometimes it's alarming, sometimes it's not. But you just have to take clients where they are. So edema is going to be the next thing we're going to chat a few minutes about. And this occurs for lots of reasons. Sometimes you have increased fluid volume. Some texts say 50%. Some texts I read say 100%. So your fluid volume can double in some instances. You also have that enlarged pregnancy that acts like a cork that keeps the fluids down into your limbs, into your lower extremities, and even pregnancy hormones like progesterone. And the word progesterone literally breaks down to promote gestation. So that's what that word means in Latin, to promote progesterone, to promote gestation, which is pregnancy. But it does cause some relaxation of some ligaments as well. You've got relaxin in there as well, which helps loosen up some of the connective tissue, so fluids are moving around, they're moving away from the blood vessels into the interstitial spaces. And edema tends to be more severe at the end of the day and during the summer months. I just want to kind of show you some pictures. Here is some edematous feet and ankles. And this is showing you a picture of what pitting edema looks like. It looks doughy, and massage is very important for it. So what can you do? You can get them to elevate their feet to raise them above the level of the heart. You want to use things like light effleurage applied centripetally, which means toward the trunk, toward the heart. You can also do some skin stretching. I'm going to show you a really cool picture in a second of a lymphatic vessel. And best practices is to massage proximal to the affected area first, then proceed distally. What does that mean? Massage the thigh first, then massage the leg, and then massage the ankle, and then massage the foot last. People who know anything about moving lymph usually recommend about 5 grams of pressure for this light pressure effleurage and skin stretching, which is about the weight of a nickel. This is showing you what a lymphatic vessel looks like. I want you to notice a couple of things in this picture. Notice, look at the anchoring filaments. These anchoring filaments are going to be attaching to the superficial fascia. Notice how these, just like some of the veins do, have a flap in it to keep the fluids moving in one direction toward the center, which is going to be the lymphatic duct and thoracic duct and the right lymphatic duct. Notice the flap. This is how lymph enters and exits the capillary, the lymph capillary, and through a flap. So when you pull on those filaments, those anchoring filaments, you open up the flap, and then the interstitial fluid can come in, and now we call it lymph. So this is a really cool picture for you to understand how the importance of the light pressure for moving the lymph. And again, I really, really like this slide because it kind of pulls together some of the stuff we've already talked about. If it's mild swelling of the legs, feet, and ankles, it's normal, it's not contraindicated, it's beneficial. But if it's widespread swelling, it could be preeclampsia. It might require a referral. If it's unilateral leg swelling, it might be DVT, especially if it's in the presence of the other signs and symptoms we talked about, which is the heat, the redness, the swelling, and the pain. So be mindful when you're looking at edema, what it might mean. How are we doing?
Susan, I'd just like to say we're in the third trimester of our talk tonight. And we have a few more minutes, and then we'll follow that up with chat questions.
That
So
sounds great. Thank you so much.
hopefully you can wrap it up. Okay, great.
Okay, just a few more minutes. I appreciate it. So varicose veins, it just enlarge veins by incompetent valves. Those valves that I showed you are also present in the veins. And usually with weight gain, it's like if the valves are like here when you're not, when it's not, you're not stretched out, the veins, the valves start to not touch anymore, and that can lead to a pooling of blood. So avoid the affected area because of the blood clot risk. And this is also for 10 weeks postpartum. And the last thing I want to mention is, oops, wow, we're so close. The last thing I want to mention is I do have a blog, and I think you mentioned it too. It's called Massage Passport, and all this information is going to be given to you by a handout at the end of the program, or maybe the next day I'll let you talk about that. But also this information is also in the form of blog posts on my blog, just to kind of show you. And I do go into a little bit about the pregnancy massage and depression. So and that really is it. So talk to me about the questions. Do we have any questions?
Well, I'd like to say that during your first trimester, part of the talk, there were some questions that came in. And I know one was regarding the hot tubs, and it was if your water has broken. Hot tub or not a hot tub?
No. It's a direct line of infection, yeah. And again, that's a great question. Thank you for asking. No, once the water is broken, you cannot let anything enter the vagina, water, yeah, definitely no hot tubs at all, for sure. Thank you for that question.
Okay. And I know Kirby had a question, which for some reason I'm not seeing it right this second, but Susan is asking, again, this was a question that came in during the first trimester. Can wearing compression socks be helpful during pregnancy or with massage?
Absolutely. I could not get them on, but people who can get them on, bravo. But they're very, very helpful. They're also actually helps with things like viscosities as well, not just edema. So absolutely, I would highly recommend the compression hose, stockings, socks, as to ward off a lot of that. And the best time to put them on is before you get out of bed in the morning, if they start to swell.
All right. I had a question when you were talking about the DVT, and you said to avoid the thigh, I guess, and the leg. What about the foot massage at that point, or is that a no-no as well?
This is one that there really is not a lot of evidence to suggest that it's harmful. But so, it's not, you're not going to throw a blood clot working on someone's foot. But when I'm teaching it, I just like to say it's better just to avoid the entire lower extremity. And why? Why do I say that? Because I know as a massage therapist, you zone out sometimes. The music's playing, you're in your groove. I don't want to forget while I'm working on the foot, automatically go onto the calf and the thigh area. So for me, and what I recommend is just to avoid the foot. But am I going to tell you it's unsafe? I can't say that. But I just don't recommend it.
All right, Kirby, he missed the discussion about the abdominal work, specifically about it was I think following the slide where side lying, the palms were flat. And Kirby asked, what was meant by the no airspace?
Okay, thank you, Kirby. So basically, and again, I took this from Carol Osborne Sheets, one of the classes I took from her. So what she says is, this is an airspace. This now you have a pointy tool. So when she's talking about it, she says, just flatten, no airspace. So it's just another way to say the same thing. And for this slide, I couldn't figure out how I want to say it. So I just gave you kind of a potpourri, all the different ways of saying open flat palm. So that's why I said no airspace. So that's my hat tip to Carol Osborne Sheets.
All right. And Kristen is asking, when going proximal to distal, do we still go towards the heart?
Yes.
Example,
Absolutely.
thigh towards heart, then calf toward heart, then foot toward heart.
Yeah.
And do
that's
we go,
great. So, but
do we go back over everything?
So if I'm here and you want to clear the lymphatics here before you work distally. So when you're moving stuff here, it has a clear channel to go through. So you're doing here and then, but see how I'm going still toward the heart, even though I'm working backwards. I'm going fast, but just to give you an example of what it looks like. I'm still proximal, but yes, I'm still going centripetally as I'm moving distally. That's a great question. Thanks for asking for that clarification.
And Dawn is asking, how much pressure can we use on the lower lumbar areas in each trimester?
Whew, I would say to the client's preference. Again, you're not going to harm them going deep. There's no evidence to suggest that. So really, I do it as the client's pressure preference. I'm not going to say, I can't go any deeper. I'm sorry. She'll go, excuse me, I'm going to find somebody else. And I know how I was. I wanted someone to put their fist in my sacrum, and I loved it. So I can speak from personal experience, but so just, and that's a great conversation to have with your client.
And Bree is asking, I tend to use Biotone cream, but it turns out arnica is dangerous for fetuses. Do you have a recommended massage medium that isn't coconut oil or grapeseed oil, preferably something creamier?
So this is what I want to ask you to do, Bree. I have never heard this before, and remember, I'm led by curiosity. So I would like to see where you pull that information from, if you don't mind. I put my email address at the top. It's also going to be on the handout. Send me that and I'll be able to respond intelligently about it. But I do tend to use the Biotone products. I use other products too, but I favor the Biotone products. My favorite is, can I say it? My favorite is Nutrinaturals. That's my personal favorite. Which I don't think it has arnica in it, but I would love to see what you're talking about. I want to know more. So please send me that information.
And I skipped a question. Who is the author of the clinical aromatherapy? Oops, that just went away. Therapy and term for all over swelling, please.
Okay, it's Jane Buckle. Jane
Buckle,
the guru. And she is, get her 3rd edition. She really rocks it. And she's also the person that developed what's called the M technique, which is my favorite technique for working with frail clients, frailty, medically fragile. So great resource to have.
All right, we have 3 last questions here. Also, is there any contraindication in using cupping during pregnancy?
Whew, another great question. Yeah, I don't know. I can't imagine it would be, because it's basically decompression on the skin. So, but I'm gonna write this stuff down. I love when I give a talk and I have homework. I have homework. So I'm going to find out about the arnica and I'm going to find out about the cupping. So once again, circle back with me. And again, thank you for sharing this, because I love this stuff. And I will get back with you on that one. But cupping.
All right, we have Susan asking, how do you feel about Reiki and pregnancy?
Love it. Absolutely love it. I think it's very supportive of each other.
And the last question that we'll read tonight is how to deal with postpartum depression.
Okay, that's its own separate topic. That's actually a great way to end today, really, because go to my blog. I've got a whole lot of sections in there about it. And it talks about the research. So focus on the research and try to duplicate the methods sections in the studies as much as you can. You have a lot of research on it. So it is very, very beneficial, but take the deep dive. If you're interested in the topic, take the deep dive and check out those blogs. And if you need anything else that you can't find, I've got a medical library that I can access at the university. I can get it for you, because sometimes there's that paywall, you know, when you try to get the research, I can get it for you. So just keep in touch with me through Facebook is fine too, but email me and we'll exchange information back and forth. So this talk is just hopefully the beginning of many conversations about pregnancy down the road.
Yes, and there's thank yous that are coming in. I thank you as well. I want to let everyone know that tomorrow we check your inbox, and if you don't see in your inbox, check spam, but we'll send the follow-up email with tonight's recording and a different handout that Susan has prepared, as well as Susan's contact information and her blog address. So keep an eye out for that. And I'd like to mention we have some great EduTalks lined up. June 6th, we have Ruth Werner, and she'll discuss massage therapy and skin cancer, a closer look. On June 20th, we have Eric Brown, who'll discuss the fainting phenomena, why people faint during chair massage, and something new that we are doing with EduTalks is we've launched a new series, EduTalk Diabetes Series, and it launched May 16th. I'll include the website in the follow-up email. Let's see, what else? Oh, we have the next EduTalk Diabetes Series, and watch for the invitation, June 13th. And it will be Diabetes Diagnosis to Freedom with Irina Sternina. And that invitation will be going out soon. Thank you, everyone. Susan, tons of thanks. Thank you for discussing the reflexology myth. And everyone be safe.
Yes.
Thank you very much. Thank you, Susan. Have a wonderful journey ahead. And watch for your inbox follow-up email tomorrow. Take care, everyone. Be safe. Thank you.